Hello, Dr. Donna Kinchlow, and we are going to talk about what is heart failure using the infographic from CardioSmart, the American College of Cardiology. Task force group from there actually helps to write the guidelines. Believe me, heart failure education can't be stamped out with a cookie cutter. Our patients and our families bring a variety of diversity to every conversation. Heart failure patients include all professions, ages, social issues, multiple comorbidities, and best of all, an amazing variety of personality. It's a very scary topic for a lot of people. And I want you to realize that one of the greatest things you can do as you're educating them and trying to find out what they know, you need to summarize and acknowledge the greatness and the skills that they already have. When we teach adult learners, you have to realize that oftentimes we can relate some of the things that we're going to teach from a medical standpoint and make it fit nicely into their lives. When you look at the CardioSmart Infographic, this does a lot for you because you see, some patients don't like to read. And this gives them an infographic filled with a lot of good information. Simply ask, have you ever been told you have heart failure? And if they answer yes, ask them, what's that mean to you? And let them tell you. Let them describe and define heart failure in their own words. And some of them won't even know where to begin. Some people are aware they have heart failure and have managed it for years. You have another group of people that may be new onset heart failure patients that never heard the term and are afraid of it. No one wants to fail in anything. You don't want failure in your life, especially when it's connected to your heart function. So, I live in the Midwest, and we have the joy of dealing with many patients who understand farming. And they understand pumps and pipes and valves and fluid dynamics and pressures. So I can have an awful lot of fun while I am teaching heart failure to our patients, and I oftentimes relate it to a pump. And even women patients understand sump pumps if they live in the floodplain or the flood zone. So when you look at this infographic, what is heart failure? You kind of need to let them have an idea of what the purpose of the heart pump is. Your heart is a muscle and it is a pump, and its purpose is to give your body blood flow, which provides oxygen and nutrients to all your tissues and cells all throughout your body. Every part of you wants a good blood flow. So when you have heart failure, it's actually a pump problem. There are two ways they describe it in the infographic: systolic and diastolic. With your systolic heart failure, you've got a thin wall, but you've got a lot of blood in the pump, but you've lost pumping power. You have a patient that maybe understands squeezing or contraction or whatever terms work for them. That's the term you hang on to, especially if they give you an answer to what they believe this to be. Weakness, weakness of the heart. And of course, right here on your infographic, it says your chambers can become large over time and they can be weak. So the pump is weak. And a lot of people know their heart failure to be that. The doctors told me that my heart is weak. So you're not able to give the body the blood flow that it needs because you've lost pumping power. Now, your diastolic heart failure, on the other hand, you have a very strong pump and very thickened, powerful walls. But when you have powerful walls in your heart pump and they are thickened, you end up not being able to relax and fill. And so diastolic heart failure you're having a failure of volume or a filling failure. You don't have enough blood to pump, even though your pumping is extraordinary. Your chambers get stiff, they do not relax. You might see words like non-compliant heart muscle, and that's what happens. So regardless of the two types, the symptoms are very similar. And this will move down to what are the symptoms. At this point, you ask the patient, can you relate to the little blue man and symptoms that you have experienced? Oftentimes they'll read to you. You will know if they're able to read. You'll be able to know, are they able to see? And they will point out all the ones that matter to them that they have seen or experienced. Extreme tiredness or weakness, rapid changes in weight. They'll even tell you how much weight they gained when they came into the hospital. I'm up 15 pounds. Feeling lightheaded when you bend over. Swelling in the ankles, feet, legs, or tummy. Many of them will say, right here in the breadbasket, I just feel bloated around my belly. I can't get my britches on. My belt, I can't wear it in the same loop. Rapid irregular heartbeat, oftentimes atrial fibrillation will put somebody into heart failure. Shortness of breath. And they will go through these symptoms, and you'll be able to give them a few statistics there in your bubbles. 6 million Americans have heart failure. It's the leading cause of being in the hospital if you're over 65. And they're going to want to know why. Why the symptoms? And this is the point where you explain the process of fluid overload. When our hearts aren't pumping effectively, there will be backup of fluid, and the pressures make us juicy or leaky, and fluids go in spaces where they don't belong. You have little air sacs in your lungs, and when they get filled with fluid, you feel like you're drowning and you cannot breathe. And they'll agree with you if they've experienced that. Your belly, your feet, your legs, the doctors and nurse practitioners will push on your shin bone, and they're looking for edema or fluid in your tissue. Oh, they'll understand. So they know, and it's very important that they are able to say what symptoms belong to them. And then you jump down into the causes area. And this is where, over time, we'll go through some of these specific causes with some different sessions in the future. You have an icon for heavy alcohol or drug use. There are multiple medications that are toxic to the heart myocytes, muscle cells. And you know there is such a thing as alcoholic cardiomyopathy. So alcohol and drug use, and it is sometimes drugs you don't even think about that can create problems. Ibuprofen, Aleve, NSAIDs can exacerbate heart failure. You have to find out from your patients when you do a very good physical and history assessment as far as their life habits. How much are you drinking? You may have a gentleman who's drinking fifths of whiskey and cases of beer, and that's an awful lot of fluid to put on a heart that's having problems. You may have a patient who's had high blood pressure, undiagnosed for years, and maybe this is a brand new diagnosis, or they have had a high blood pressure and aren't good with taking their medications, and it's an uncontrolled scenario. So it makes sense that when you have high blood pressure, that heart pump has to push hard against tight pipes, so to speak. And so high blood pressure is one of the things. It's very important, if they have this, that they realize we need to keep that under control. Diabetes, of course, is going to thicken the walls of the vessels and create, again, more pressure for the heart to pump against. It accelerates an awful lot of things, including coronary artery disease. And so keeping diabetes under control is also an important piece. Sometimes when patients come in, they're not only told they have heart failure, but they might end up being a new diagnosed diabetic. That's an awful lot to grasp. Family history, many people are familiar with someone in their family who has had heart failure, and they'll tell you. Heart rhythm disorders, whether it's bradycardia, whether it's atrial fib or flutter or rapid rates, heart rhythm disorders can cause heart failure. Valve problems, we find an awful lot of people with mitral valve and aortic stenosis or regurgitation. When the fluid's not going in the flow pattern it needs to go, it can create extra hard work on the heart. If you've had a heart attack, you may have hurt the pump itself. Congenital heart problems, little holes in between the septal areas of the heart, and sleep apnea. And we find an awful lot of patients with sleep apnea. And what is sleep apnea linked to? It is linked to hypertension, atrial fibrillation, sudden cardiac death, and heart failure. A lot of patients don't know that. So we will go over that as well. There's another wonderful infographic on many of these causes that you can find. So as we go through the causes and we go through this infograph, one of the greatest things, if the patient has experienced the symptoms and they can connect the causes, it begins to become real for them. Why and how heart failure has become part of their life. They'll have questions and you'll have to help them with answers. But this is a great infographic that covers many things to help inform your patients and your families what heart failure is all about. If they need to take this and explain it to their friends, families, caregivers, this makes it extremely easy for them as well. Very good educational tool for anybody trying to learn about heart failure. I thank you so much. The next session will be on management, and you will learn about the self-check plan. So I hope this is helpful. Please go ahead and subscribe to Dr. Donna's How-To World, and we will continue our series, Learning Together, how to better inform and equip our patients and families and staff about heart failure. Thank you.